Hello, now welcome back. This is a continuation of nausea and vomiting. We know nausea is a sensation of about to vomit, while emesis is defined as a process of evacuation. Now, vomiting reflex is stimulated by two centers in the medulla. This is the vomiting center and the CTZ or the chemoreceptor trigger zone, which has a high concentration of receptors for serotonin, the 5-HT3, dopamine, and that's D2, and acetylcholine, the muscarinic receptor, and the cannabinoids and opioids. We know the other side effect of opioids is nausea and vomiting. Now, serotonin, which is released by endochromaffin cells of the small intestine in response to an anti-cancer or chemotherapeutic agent, trigger the vomiting reflex. So we know that also anti-cancer cause nausea and vomiting. Now, the emetic drugs, which are used to induce vomiting in case one has ingested poison, you can use apomorphine, because we have said above that the CTZ has high receptors for more opioids, but morphine is an opioid. Ipecacuanha, this is a natural origin plant syrup. It contains emetine. It acts by irritating the gastric mucosa as well as the CTZ. The 5-HT receptor antagonists, they block or antagonists of 5-HT receptors located in the CTZ and other side and suppress nausea and vomiting because induced by the serotonin. Now, of course, examples of ondansetron, granisetron, dalsetron used in chemotherapy induced or post-operative nausea and vomiting. The side effects, you can look for them, can get them. I'm sure you will find you get. Now, the metoclopramide, of course, this one is a plus, it's a prokinetic agent, blocks or antagonizes the D2 receptors. This results in increased GIT motility. Remember, you antagonize, you want to counter the vomiting out, so you cause the vomiting down. Oh, sorry, the increased GIT motility. It can also cause they can also block 5-HT3 receptors in the CTZ. Now, chemotherapy induced, they are used in chemotherapy induced nausea and vomiting or adjunct in medical or diagnostic procedures such as endoscopy. However, the side effects, we have extrapyramidal effects since they block D2 receptors. Now, these extrapyramidal side effects, we're going to look at them you can search our presentation on antipsychotics. Now, domiperidone antagonizes the D2 receptors without the involvement of other receptors. And this one does not cross the blood-brain barrier to cause extrapyramidal side effects. Now, I'm sure you are aware that in the pharmacy we have domiperidone combined with pantoprazole, or what we call the Panto-D, because it doesn't cause extrapyramidal side effects, which may happen with Placil or Metoclopramide. The others which could be used is the atypical antipsychotics, olanzapine, because they block D2 receptors, antihistamine, cyclizine, meclizine, promethazine, and diphenhydramine act on H1 within the brain stem and used in motion sickness and post-operative emesis. Muscarinic receptor antagonist, hyoscine, can be used in motion sickness as it was thermal patch, cannabinoids, and sometimes when we reach which one, general anesthesia, we shall realize that dexamethasone and diazepam are used as adjunct to control this nausea and vomiting. Let me briefly talk about the antiflatulence. This is an agent which is used to relieve excessive intestinal gas. We have examples. We have the antifoaming agents such as simethicone. Now, this one, it coalesces the small gas bubbles into large ones. Now, you may not get simethicone alone. However, you can use simethicone containing antacids in flatulence. If a patient comes complaining of flatulence, enzyme-based dietary supplement BINO digest substances such as such that they don't reach the colon where they are broken down by the bacteria to produce gas. Charcoal tablets are used. Now, I was supposed to talk about herbal, but of course we know that herbal are also used. The ginger, pepper. There is that product in the pharmacy called the Ino. I don't know what it contains, but I just had to put it here for us. Now, this is a continuation of the other diarrhea and constipation. Refer to them. Always remain Wilson from M-Pharma Training Solution. Contact us for more information via email. Subscribe to the channel in case you haven't subscribed. Leave a comment, and thank you very much.